Hi, I'm Dr. Johnny. Thanks for joining me today. I'm super excited to bring this one to you. Everyone's asked about it. It really ties in with our cheek contouring, the jawline we did, and what a lot of people ask when we put the Bella Hadid picture up about the rounded, younger, welcoming face to the high cheekboned, chiseled runway model. Some people like one, some people like the other, but facial contouring, Korean V-line slimming. Many people go to the for surgery overseas. A lot of people don't do it here. So I'm going to talk about it today, and most importantly, I'm going to talk about 5 or 6. We'll see what comes to my mind. I have at least 3. You know, I just keep rolling off what comes to my mind here. I don't have much planned, but I already know 3 or 4. I bet you I'll come up with 5 or 6 ways without surgery that I'm contouring and narrowing the jawline, or giving the illusion of narrowing the jawline using Botox, fillers, threads. We're going to go through. I'm going to call out 5. I'm going to go out on a limb. I'm going to come up with 5 non-surgical great ways to slim, to contour. It's cultural. It's sought after by the youth. In the older person where there's sag, we're doing that anyway because we square as we age, and there's male-female differences. Although, as we talk about in all of our prior videos, androgyny, the coming together of the sexes, so the males can look a little feminine and the females can look a little masculine. And where does that dimorphism lie? So where do we draw the line? We're diving into it. Most importantly, 5 non-surgical ways, because when you hear about the surgery, you may not want it. If we look at this picture here, it's subtle, but look at the jawline. If you take a little look along the gonial angle and then you look at the chin, there's just a narrowing appearance that adds a shapely look. And don't look too closely too long, just do the quick Tinder test. What that means is you're looking real quick. Are you swiping right? Are you swiping left? Boom. The one on the right is going to be more attractive. So remember, your eye is calculating within 3 seconds, 1.6 to 3 seconds, whether the face is attractive to you or not. There's many things that go into it. We dissect that out on this channel, but that's the facial narrowing on the patient on the right. Now, if you look here, this was the Bella Hadid before and after, and a lot of people thought Hadid on the right looked more model-like, more high cheek, older. Whereas on the left, she looked more approachable, girl next door, relaxed, softer look. And in fact, the Middle East, they would much prefer the left rounder look than the right, which is more the model high cheek look. So there is some cultural difference. Okay, so the Korean V-line surgery. Now today we're talking about non-surgical options. Most people want non-surgical. Over 95% of the market, to the people doing a lot of surgery, they don't like to hear that. They want non-surgical solutions. And to boot, people want to come back every 2 to 3 months. So it's recurring. Remember, nothing's permanent. So a lot of people ask, I want the longest lasting solution, the longest lasting filler. A lot of times when they find out side effects or problems with them, they really don't want the longest lasting. They think they do, but there's a happy medium. Surgery, while I was going to say it's permanent, you might not come back for 10 years, but you're going to come back. And the reason is the face is always changing. So a facelift is not permanent. Why? We age. The bone changes. The skin becomes lax. If you take care of your skin, it'll last longer than if you don't. Sun exposure, sleeping, avoiding detrimental things like pollution, using vitamin C's, retinoids. It all helps things last longer, but nothing's permanent. The minimally invasive market, people like to change things around a little bit. They don't necessarily want permanent sometimes, and the word permanent scares them. So there's surgical and non-surgical. Nice to see the differences. Non-surgical, you want to find someone close by, preferably, because you're going to be going back every several months. You're going to want to go back because people like to see gradual, natural looking results. Surgically, for this procedure, why a lot of people want to do non-surgical, I'm talking about them, is the surgery for the V-line involves several things, and I think I might do a complete video on it because I know I have patients who go get it. They love it. They wanted something more dramatic. They didn't want non-surgical, or they didn't have gain from non-surgical. I'm going to go through that. But it involves cutting bone, sliding osteotomies, geniotomies, and what happens is taking a piece of the bone, most commonly in a T-shaped fashion, sliding the bone back and in an inverted V-shaped pattern, and even removing bone from the edge laterally. Sometimes it's needed, and remember, in other cultures, people are much more apt to do surgery and at younger ages, but sometimes smaller surgeries at a time and multiple surgeries. Whereas a lot of times in America, in Canada to a lesser extent, people want to go in and have everything done at once. Not every culture is like that. Not everyone is the supersized culture, so keep that in mind. So let's say you want facial slimming, but you don't want surgery. Some of the main reasons people want it are the heart-shaped face. We talked about that when we did the jawline video, and I'll put a link to that below as well. Just facial shaping. As we age, there's some laxity in the skin, the fat grows, we become square. For the male, it's okay to be a little more square, but you don't want square around the mouth. It widens, there's a downturn of the mouth, and it looks aged. So what are some of the things we can do? Let's start with number one. And I'm just going through in my mind right now what I see in clinic, what people ask me. And the first, so in no particular order than what comes to mind, because it's more common, Botox. When we talk about Botox, it doesn't build collagen, it facial shapes by removing, decreasing, atrophying, shrinking, however you want to look at it, muscle. It stops muscle movement. That's why I have a video on Botox dirty little secret, because people think it makes them look younger, but it actually doesn't have much effect on the skin other than oil production in a few different aspects, but it doesn't make you look younger in terms of making the skin better. So how does it shrink? Now you can do facial slimming, and my video on this will show you can watch the injections if there is muscle. Let's say it's all bone and no muscle. Not a great option for you. If there's muscle, and it's so common in America, I can tell you for sure, Asia as well, but Americans clench, and your dentist will tell you that. And oftentimes people are losing teeth. In that case, I'll definitely treat it with Botox to the masters. You shrink it, it decreases the size of the muscle, thereby shapes. You could get some loose skin going forward, not a problem. We fill it. Expensive? A little bit, yes, because what are you doing? I did about 3 today, 15 to 30 units per side. So think 50 units. Repeat it every 6 months, but less and less over time. You see results in a few months. And as it shrinks, you can get the skin coming forward, the RBF, the downturned mouth, but that's easily treated with fillers, biostimulators, but there's the added cost. But what's a tooth cost? In this country, in the United States, a little cheaper in Thailand, different countries, but here 6 to 8 grand for a tooth. So if your dentist says you're grinding back here, you have masseter hypertrophy, we shrink it, you have facial slimming, win-win. For a male, sometimes they chew gum, they do exercises to get a bigger masseter to become square, pulls the face back. So understand Botox, that gives you a little bit about it. Actually works very well. The consult is key. On here, everyone's asking me, hey doc, I have a saggy eye, or I have a wide face, can I do Botox? Understand, I did 3 patients today. I have to grab and feel that muscle. Some people have a broad muscle, some it's more anterior. There's a risorius, a muscle that affects smile. I can't get an anterior muscle without risking the downward smile, the loss of that risorius muscle. Grab your anatomy, look at that. A common one. People who start doing Botox and masters, I'll get a call, hey doc, this doesn't make sense. I just treated someone's masseters and their smile after a week is not right. It's crooked. It's turned down. There's certainly is a muscle there. very similar to the nasalis with the muscle right next to it that lifts the lip. You got to look at the anatomy. So that works well. That's number one. Number two, I still have to go to cheek filler. Now, a lot of people in Asia, and I'm saying that because it's the Korean V-line is how you're going to see it. So by nature, a lot of Asians do it. A lot of people fly from here to Korea or Asia to get it. A lot of times they'll talk about the maxilla and taking a piece of bone out of the maxilla. Yes, when you get cheek fillers and they hit your bone, the periosteum with the needle, it hurts. Bone hurts. Just like knee surgeries and osteotomies. And if you think about that, it is a painful surgery, yes. And there's muscles attached to the bone, but they remove a portion. Why? A lot of times in Asia, people want softer bones. They don't want the high Bella Hadid cheek. They like the softer look of the pre-Bella Hadid. I'm using her name because I did the video on Bella Hadid, and I also showed Cameron Diaz's cheek versus hers. Go back and watch that video because you'll see one's a warm, welcoming cheek. One was in Bella Hadid, but when she changed it, and we'll talk about buccal fat reduction a little bit, watch my video on that, it angled her and people said she looked more cold, older, runway model, screw you type. So the cheek is important, but how does that factor into non-surgical facial slimming? Easy. When you fill the cheek or the bizygomatic distance, by nature, you're going to make the bigonial. The gonial angle is here, more upright in a male, more shallow or larger angle number in a female. And you're going to make this illusionary smaller by increasing here. Why do you have to be careful? You can't bring the eyes too close together. Well, we're not moving the eyes, but as you go further out in the cheek, the eyes then look narrower. Very complex, and it's why people still here on Instagram, people send me all the information. We get the DIYs, the do-it-yourselfers who are having problems or bought home devices for slimming, and they'll be panicked, they're losing facial fat, brow droops, high pen problems. Instagram, they'll message me, and it's still the cocktail picture. I need 5 views, 1, 2, 3, which are 45s, 90s, and then I need expression. And sometimes you have to just feel. So you know, to get an idea of what's going on. But cheek filler can really help. Watch my parallel lines of beauty video where the parallel lines of the cheek equal the jawline. Let's go now, number 3. Another one, relatively easy, but be careful. Watch my video on chin filler disaster, because filling the chin narrows it. And you can watch me, I got chin filler here on my video last week. I think it was called My Procedures, My Aesthetic Procedures, My Non-Surgical Facelift, something like that. I'll put a link, watch that. Chin filler narrows it, and if you go back and look at pictures of me 3 weeks ago from YouTube here, you'll notice it's wider here. I left it narrow, I didn't massage it. It will flatten a little over time, but we just left one bolus, and that makes it look narrow and gives a more narrow look. Very common. A nice product for this is something with a high G prime. If you're using high hyaluronic acid, something like Restylane Lift. Using a soft product, forget it. Again, no one comes back to me and says, Rajani, I wanted the soft, elegant, smooth product. No. They want power. And if you want permanent, use PMMA or Bellafill, chin implants. But the chin can be manipulated. Remember I said the part of the V-line surgery could be a T removal of bone or a sliding removal of a V-shaped sliding piece of bone in the chin. Adding filler can narrow it and also give you projection. A lot of people had their teeth removed, had braces. I have deficient jawlines, and go back and look at my lip fillers with the AE line. So it does a couple things. So that's number 3, chin filler. Number 4, and I have a video on this, facial slimming with PDO threads. The Barb 4s are amazing. I just did a bunch of lifts. In fact, over the past 3 days, we've been catching up from just a plethora of patients with what's been going on lately, and then fires and everything. There's a backlog. We've been working morning to night to get through people, and I've been using more of the molded threads, preloading them in the morning. And the molded threads, and I was talking to my European colleagues last week, just are the way things are going. And the shape of the molds are very important. I'm really happy with the molded Nova threads that we've been using. Just the barb 4s have been great. I've gone back and forth between them. But the molded threads, if you want the maximal lift, and the younger generation come in for this for sure, because they want the maximal. They follow their post-care instructions. It's a barb 4 on my video. I'll post a link to of a patient for facial slimming with threads. For the older patients, and you can watch, I know everyone's going to say all the patients and models are young. I have a whole playlist now on mature skin. I have older patients there, and you can watch them having the threads. By nature, that's going to give them a V-line because it's sag in a sense. The fat's fallen, the face fallen, the bone has lost structure support, and we're lifting. So that by nature gives a great V-line. So PDO threads, particularly the barbs in this case, smooths will surprise you if you're patient. They really will. 2.5-inch smooth and twist, but immediate results with the molded and the barbs are amazing and great for non-surgical V-line Korean facial slimming. Number 5, are we at 5? Of course, if you pinch it, and even if there is no masseter to toxin, then there's fat. So you can remove the fat either by liposuction, buccal fat reduction. I have a whole video on that, and if you want a new one, I'll show you some video footage of how that is. It's through the mouth. By the way, the Korean V-line surgery, a lot of people might be thinking how's it done. It is done through the mouth, just so you know, for scar purposes. But a lot of people non-surgically, you just want injections, you want to be in and out, Kybella. And a lot of people on here don't use Kybella. There's a lot of Euros on here, a lot of Asians. I love it. I love our international crew. And of course, Belkira is the Canadian one, but overseas there's PC, PCDC. So phosphatidylcholine and deoxycholate combinations, because when I work with the pioneers of mesotherapy from France, they really believe that combination of PC to disrupt the cell membrane and DC to kill the cell, the fat cell, is important. So they use a combination. Back in the day, I would add a little bit of collagenase and carnitine. Collagenase self-explanatory what it does, but the carnitine was a skin tightener. If you want to add a little bit of lidocaine, we used to use Procaine. We used to, because a lot of this stuff is all stuff we've done forever. Okay, you hear it's new and improved, and people, no, it's what we've done forever. So a lot of times we have, the older generation, there's a bunch of tricks and tips we use with it because we use it differently in such large volumes prior. Understand, key point, this gets rid of fat, right? Yes, it's long-term permanent, but what else is fat involved with? Nerve transmission, myelin, the electrical impulse travels down the nerve. Look at that. And that's that myelin sheath is made up of fat. So you will get rid of motor nerves, and it can change sensory nerves by getting rid of myelin. And so there can be nerve damage. It almost always returns. I say almost, I've never heard of it not, but a higher dose, it can last a while. See an expert. Facial slimming with Kybella or with these types of bile salts, PC, PCDC combinations, needs to be done properly and in the right dose. And multiple times. You're better off lower dose, doing a few. It's more resistant than the neck fat and some of the body fat. So just be mindful. Don't get impatient. It takes a few sessions and can cost some money. Lastly, I gotta talk about it, which is high frequency ultrasound. I'm including in there RF. Watch my Ulthera video, my Ulthera versus HIFU, high frequency ultrasound versus RF, radio frequency. Watch those videos, but everyone, there's a ton of people on the Ulthera forum or the Ulthera video in the comments that talk about their fat being reduced. And I know a lot of people are buying high frequency ultrasound devices online, cheap, and they're home devices, they're using them. The energy is variable. I can tell you on this phone, the number of people that in the run of a day, maybe I'm going to get 10 to 15 side effects, some from physicians wondering things. A lot of people I've trained, but a lot of people with do-it-yourself stuff, and they're on month 3, 4, 5, and they're panicking because their facial fat seems to be gone. The energy in the device is key. The device I use for RF, I can change the frequency. I know the power output. It's studied, it's tested, and I can change how deep I go, how hot I go, and for how long I treat. These are arts, and technicians who do, say, Ulthera, the real good ones, they know their device. They get great results. They've treated hundreds of patients. They know skin types. When you get these home devices, just be careful. I could care less that you're using them, that you're doing them. If you love them, power to you. Don't harm anyone else. Don't treat other people. Don't teach other people what you think, because you only know it for yourself and your skin, your anatomy. They might be the disasters here because they're learning from you. But it takes months and years to learn to treat other people with these things because of the variability of each body and skin type. So just be careful. But yes, and I think what I'm going to do is look at some studies that show high frequency ultrasound and RF, the cavitation, the way it kills the fat cells, and look at the degree. Understand, of course, there are devices that take care of fat that use radio frequency and high frequency ultrasound marketed as body sculpting devices. So of course it can affect facial fat. And when it goes, when you lose it, people cry because it's expensive. You basically need plasma sculpt, something that's around $5,000 every 3 to 5 years to replace that fat, even if you don't need it for skin tightening and aging, because a lot of younger people are using the devices, so be careful. But for facial contouring, yes, it works well. I often use it in the thread patients who don't want fillers, they don't want toxins, they want a more natural look, and that's why they gravitate towards threads, thread lifts, PDO threads, PCL, PLLA threads, and it works well. So high frequency ultrasound or radio frequency heating at the right frequency, at the right depth, for the right amount of time. And I'd much rather people do a few sessions than try and get it all in one. And I find these expensive, what most people charge, 3 to 5 grand. So when you look at plasma sculpt or combination treatments, they're often 3 to 5 grand, but that's what things cost. Facial slimming, facial contouring, it's a whole business. It's a whole art. It's where everything's going. Everyone that walks in the door the last few days, old to the youth, what they're talking about, yes rejuvenation, yes skin, yes lines and folds. I don't see the top people talking about reds and browns and all the things we talked about 10 or 15 years ago that bother people, like, oh, my brown spot, doc, I just want that gone. But they look 60 or 70 here when they're 40, but they're looking at a brown spot. And I have to say, it's not the brown spot, it's the face that's aging you. So we had to redirect them. Not anymore. It's all about contours, angles, folds, lifting, and it's really fun work. And remember, if you're into aesthetics, you can have it now. You can pick and choose. If you're not into it and you don't want it, that's cool too. It's fine. It's whatever you want. We're growing skin in petri dishes. People are going to create their looks over time, whether you embrace it or not. But it is up to us. It's up to the people online. It's up to responsible people to give honest opinions to patients and clients, and be careful if you're doing this stuff yourself, which we never recommend. So it's all about having someone follow you for years and years over time to give you the best results. Facial slimming, I want to hear, have you done it? Have you had the V-line surgery? I think maybe if you want, we'll do a whole video on the surgery part of it. Very fascinating. Not a lot here in this country, but definitely in Asia. Stay tuned. Keep your skin and body beautiful, healthy, vibrant.